I saw your message, Melissa, but I don't know if Mandy, you had anything you wanted to start with before we jumped in. I think I saw her somewhere.
I don't. I mean,
Okay. Okay. All right. I'm going to share my screen.
And just make that a little bit bigger, like the actual slide. Yeah, perfect. Thank you. Okay, so hopefully everyone can hear me. I know Melissa was having some technical difficulties with her sound. But we're here today to do the 2024 HMIS and non-HMIS point in time training. I think most of you probably know who we are, but I am Robin Melchinoff, and I'm accompanied by my partner in crime, Shertina Walker. We both work for the Institute for Community Alliances. We are the HMIS system administrators for the state of New Hampshire. So we are the ones who are managing the HMIS here in New Hampshire. We work across all three POCs in the state. We're the ones who are always bugging you about your data and running reports, and we submit all of those things to the federal government, to HUD. So that's kind of what we do. We help with the point in time training every year. This is kind of a two-part training. We're going to talk about both HMIS and who enters into HMIS and that process and what it looks like, and then also the non-HMIS agencies. So those agencies that do not have access to HMIS, they don't have anyone at their agency entering into that system. So 2024 point in time count. Our agenda today is that first we're going to go over a little bit of a background pit information. We might have some people on the call today who have never participated in the point in time before. So we're just going to give a little background about what it is and why we do it and when do we do it. Then we're going to talk about the those agencies that do enter into HMIS and the sheltered count, what that process looks like, what the timeline for the reporting is going to look like. And then we're going to take a look at the actual reports themselves and kind of go through what they're going to look like, what sort of errors you should be looking out for, how we're going to get those reports confirmed. And then we're going to talk about non-HMIS and the unsheltered count. So we're going to do a timeline for that as well. We're going to talk about the type of people who we're making sure to count for the point in time, and then the people who we want to make sure we're not including in the point in time. How that data is kind of collected for agencies that do not enter into HMIS. And then we're going to talk about the paper survey and the Google Forms for non-HMIS.
And we just wanted to mention that we're going to stop every now and then for questions. So if you could avoid putting them in the chat, just because it will be difficult for us to respond in the chat, and we will be responding verbally. And once we stop, we'll stop in between every few slides. We'll just let you unmute yourselves and you can ask any questions as we go.
We also have Mandy on the call too. Hopefully Melissa will be here at some point if she's here already, but Mandy can jump in and answer some questions for us too if they go beyond our skill set of data. So a little bit of background on the point in time. The point in time is an annual count and survey of both unsheltered and sheltered homeless persons, and it's conducted on one single night every single year in the month of January. Every community nationwide participates in this count, and it's categorized by 3 program types, which is emergency shelter, transitional housing, and safe haven. So again, we have those 2 project types. We have the sheltered, which are agencies with the above programs that will count individuals that are physically staying in a bed. And then the unsheltered are agencies who are going to count individuals who are sleeping in places not fit for human habitation. And we'll talk about that a little bit more as we go through this PowerPoint. So when do we conduct the point in time? Hopefully everybody knows what the point in time date is at this point, but the night of Wednesday, January 24th, 2024 is going to be our point in time for New Hampshire. You can collect the data for up to 7 days after the point in time, but we always just want to be making sure that we're asking, where did you sleep on the night of January 24th, 2024? Because we're collecting data for that single point in time, we want to make sure that that's, even if it's 2, 3, 4 days later, we want to know, where were you on this night? We have I think somebody unmute. Oh, okay. I was going to say, Melissa, I think you muted me. I unmuted myself. I should be good. So important to be asking people, where did they sleep on the night of January 24th? Only clients who were physically in a bed or who were unsheltered on January 24th, 2024. Those are the clients that we're going to be counting for this point in time.
Does anyone have any questions before we get into the nitty-gritty of the point in time? All righty.
So first up, we're going to be talking about the sheltered count, and these are for HMIS agencies. So HMIS data is used for all agencies that enter their shelter, their transitional housing, or their safe haven data into our New Hampshire HMIS. ICA is going to pull the reports for you and send them with an email. We do this every year. So agencies who have been around for a while and who've been participating in this, it's the same email that we send every year. It kind of breaks down, this is what we're expecting of you. Your report is attached. Here's things to look for. And then we usually link you to our knowledge base, which has more Pitt and Hick resource guides on it for you if you need that. So that's going to be sent to you January 20th, which is the day after the point in time. Please pay attention to the timeline and due dates. We're going to go through them in this PowerPoint, but they're also on our knowledge base. They've also been announced in the HMIS newsletter that we send out twice a month. We do understand that the timeline might seem a little tight as far as making sure all your clients are in there, making sure the data is correct, getting a confirmed point in time report. But we also have to finish our work so that we can submit that to PUD. So we just want to make sure that we're kind of keeping with the timelines as close as we possibly can.
Robin,
and then again, yeah.
can I interrupt you for 1 minute?
Sure.
Can everyone please make sure that you're muted? And if you have a question, you can raise your hand. And ICA will be checking it for questions throughout the presentation as they stated. Thank you.
Thanks, Christy. So again, be on the lookout for emails and newsletters from ICA. Both are going to contain important information. We are always squawking about the newsletter because not a lot of people read it, even though we have all of our most important information in there. So especially at this time of year, you want to make sure you're keeping an eye out for that newsletter because it's going to have important information in it. Again, keeping an eye out for emails with your point in time reports. We might need to go back and forth a couple of times to say, oh, we still see that this is missing. You still have some things that you need to work on. Can you look again? And we'll send it again and confirm. Sometimes it's a little bit of a back and forth. So you just want to make sure that you're watching out for those emails just to make sure that we're getting those reports in when we need them to be in. So here's that timeline that we talked about. Thursday, January 25th. Again, that is the day that we're going to be sending out all of your HMIS PIT reports to you. Thursday, February 1st, a week later, all of your data needs to be entered into HMIS. So this is kind of when that back and forth process happens of, maybe sending us a report and asking if it looks good or adding clients or taking out clients that don't need to be there or fixing data. That's kind of going to be that week between when you're getting sent your report and when all of your data really needs to be entered into HMIS. And then a week after that, that's when we need the confirmed and accurate PIT reports. So that'll be Thursday, February 8th, 2024. That's when those reports need to be done to us, confirmed, everything's accurate and good to go. Any questions on the timeline? This timeline, again, is going to be in the newsletter and it is also on our knowledge base. So if you forget and you need to look back, you'll have various places where you can go back and find it. And feel free to always email us at the help desk if you have questions about it as well. So diving into your PIT reports, you may see some errors or some missing data when you're reviewing your PIT report. We're in a much better system this year, and we were last year too, so we saw a lot less of this, which was nice because the system kind of forces you to not make mistakes. But there still may be some things that you need to go through. What we find a lot of times is we send the PIT reports and people don't even look at them and they just say, yep, it's good to go. And then we have to email you back and say, well, you're actually missing this data, or you actually don't have, or is this really the accurate amount of clients? And then we have to go back and forth. So making sure that you're kind of taking the PIT report when we give it to you and actually going through it and reviewing it to make sure there's no missing data. There's not going to be anything highlighted on the report for you. We're going to pull up a report so you can see it. We've highlighted some things that, might be missing, but we're not going to give you a report that's highlighted with a bunch of missing data. That's your job for your agency to kind of review that and see what's missing and see if it's accurate. So again, check that there's data in each cell of the Excel that we're going to give you. If not, it could mean that you do have missing data on your program enrollment. Or you could have missing data on your client profile. But keep in mind that children do not need to have data for things like veteran status or domestic violence. So if you see missing data in those categories for children, that's okay. That's supposed to be missing. But if you see any other missing data in your program enrollment, those are things that you'll need to address. So households is one of the things that we've seen in this new system that is not the most intuitive. It's not always easy to add people together, to go back and add them if we have new people being enrolled later on. It's the thing that people struggle with the most. So we wanted to make sure that we just went over that all household members must exist in clarity before you're able to add them into the households and the enrollment. When you're creating that enrollment, you want to make sure that all of the appropriate house members are included in the enrollment, and then ensure that you're enrolling the household in the correct program. So for things like if a head of household exits the program before the rest of the household, you have to make sure that you're going back into that file and changing the head of household. from that person who left to whoever's going to be the head of household now. That's another thing that we've seen a lot, where people are not going back and switching it to be the correct head of household. And then you get the error where there's no head of household, and then that's going to reflect on your point in time report. A child-only household means that the child is not in the same enrollment as the head of household. We've seen that happen a lot, where, you know, a 4 or 5-year-old is being the head of household because they're not being added into the enrollment appropriately with the actual head of household. The only time that that's appropriate to see is if you're a youth program who is allowed to serve child-only households. Otherwise, we would not expect to see a 5-year-old being the head of households. Any questions on that? Households are a little tough, so I just want to make sure that everybody understands that we need to be adding them in correctly.
It's also, I just wanted to quickly mention, it's something that for you to also realize how many households you have, because when we send the report, the families are together, but they aren't kind of clumped as a household. So if you serve adult and children, they won't be, it's not separated out. It just says a list of people. So you have to know how many people should be in your program and how many households on the night of the pit.
And we'll see that a little bit more. Shireen is going to pull up the report. We're going to take a look at it so we can kind of show you what that looks like. All righty. So now we're going to move on to sheltered count non-HMIS agencies. So who to count? Here is where we're going to count sheltered people who are experiencing homelessness. This is as defined by HUD, physically in a bed at an emergency shelter or a safe haven or a transitional housing designated for people who are homeless in a motel paid for by state funds, or in a motel paid for by a charitable organization. Those are the people we're going to do. And Mandy, feel free to jump in at any point in time if you want to add more information to any of these, because I know there's some confusion about sheltered and unsheltered and non-HMIS and HMIS. There's a lot going on there. So if there's any questions.
Yeah,
Oh,
I'll just jump in because we really want to clarify that HUD captures sheltered and unsheltered homelessness on the night of the point in time. And within those categories, we have agencies who enter into HMIS and we have agencies who don't enter into HMIS. So as you're listening to this presentation, just be mindful about kind of where you fit in based on your own agency. So Robin reviewed the HMIS sheltered count in previous slides. And now if you are a program or an agency that has either emergency shelter, transitional housing, and you're not entering into HMIS, these slides would be for you. These are how you would then submit surveys to collect the data.
So still sheltered, but not HMIS. Agencies with emergency shelter, transitional housing, safe haven programs who do not enter into HMIS, as Mandy just said, will need to survey people staying in their program on the night of the pit to gather that data for HUD. So you're still going to be gathering the data, just like we would gather the data in HMIS, but we're not using HMIS for that. So it's entered and submitted with Google Forms and paper forms. And we're gonna talk about those a little bit later in this presentation, but it is also important to note that all the data on the survey is required to be collected. So in HMIS, it's a little bit easier because we can, at ICA, can say, oh, you didn't collect this data, you have to go back and put in the data. But we want to remind you too that even for the paper surveys and the Google Forms, all of that data is required to be collected. HUD does not allow for any missing data for the point in time. So for example, if you're missing someone's race and the client refuses to give it to you, or you just didn't get it for some reason, we have to then reach out to the COC leads and we have to have a conversation with them about what we're going to label that, what category we're going to put this person into, because unfortunately, HUD is not going to allow us to submit anything to them with any kind of missing data on it. So that's important to note for both HMIS and non-HMIS. Okay, so this is the unsheltered, both HMIS and non-HMIS agencies. So the timeline for this is going to look exactly like the timeline for the HMIS. The dates are the same. It's just that how you're doing it is a little bit different. So Thursday, January 25th, day after the point in time, that's where we're going to start collecting data. And we can start entering, you can start using those paper forms. Again, we're going to review those a little bit further. And then you can start entering into the Google Forms as soon as January 25th. The next Thursday, following Thursday, February 1st, that's when all data should be collected and ready to be into the Google Forms. So if you haven't entered any of your data into the Google Forms yet, that's when you want to make sure that all of that data is in there and ready to go. And then by Thursday, February 8th, all data should be entered into the Google Forms. Because what's going to happen is ICA is going to work with the COC leads, and we're going to take all of the HMIS data and all of the non-HMIS data. We're going to compile that together. We're going to try to go through and deduplicate things, make sure that it's as accurate as we possibly can. And then we're going to take all of that compiled data and we're going to send that to HUD as the final submission for the point in time. So again, that's why this timeline is a little tight, because we have work to do at the end of the data collection to make sure that we're getting it all compiled together and sent on time. Any questions for that timeline? So is it exactly the same as the HMIS data? So shouldn't be too confusing. All right. So for who to count, we're counting people who are literally homeless under HUD's definition. HUD has a very specific definition of who they deem as literally homeless. We do have that information on our website, but you can find it on HUD's website too if you're curious to know what that is. Unsheltered people who are homeless. So those are the people, as we talked about before, that are staying in a place not meant for human habitation. They might be in a tent, in a car, in an abandoned building, on the street. Those are people who are do not have a roof over their heads. They're unsheltered. They're staying in a place where they should not, that's not meant for human habitation. So who not to count. So these people who are doubled up, they're couch surfing, they have a private motel stayed by their household or family or friends. Those people per HUD technically have a roof over their head. And so those are the people that they're staying in a place where they are covered by family, friends, you know, they're hopping around. Per HUD, those are the people that we do not want to count for the point in time. Anybody who's in a jail, prison, any sort of correctional facility, the DOC transitional housing, those people we're not counting for the point in time. Anyone who's in foster care, so like a home placement or a group home that's dedicated to serving the homeless, we're not counting those individuals. Anyone who is staying at the state hospital or equivalent, any of these DMH housing subsidy programs, mental health crisis bed or group homes. Again, those are all people that HUD is deeming they have a roof over their head, they're in a stable environment, they're not literally homeless for the point in time. And then any other kind of healthcare facilities, so hospitals, nursing facilities, assisted living, substance use treatment, beds and facilities. Those are the people that we're not counting. It looks like we have a question, I think, from Bob, if I can see that correctly.
Hi, it's Bob Mack. Hi, Robin. Just a quick question. As far as the hospitals, I know in the past we've reached out to like emergency departments. Should we not, would that be considered in a hospital if they're in an ED?
Ooh, that's a good question. Mandy, do you know the answer for that?
I would definitely say emergency rooms are a great resource for point in time, because it could be someone coming in off the street, was seen in that moment, and then returning back to the streets.
Right, because they're not like inpatient. So when we talk about hospitals, we're talking about people that are inpatient in a hospital kind of thing. Okay.
I would once they're admitted, they could be at the emergency room for 2 hours, right, and then be back on the street. So
yeah.
Sorry, Freeman, go ahead.
No, I was just gonna say I've always gone by whether or not they were admitted that night. So if they were admitted, they were inside, you know.
Yep.
That makes sense. Thank you.
Any other questions on that?
Also, if somebody is arrested and just taken to the county jail to be booked, but are not going to, with bail reforms, many get let out that same day, that they were able to be counted as well, right?
Yeah, so I think what's important, and Mandy, if you want to jump in here too, it's more of like we're looking at a single point in time for one night versus like a long-term stay for clients. So like Bob was just saying, if they're going to be admitted to the hospital and we know they're going to be there for a week, that's or 2 weeks or whatever the case is, those are clients that we might not want to count. Otherwise, we're counting them if it's not a more stable environment. If that makes any sense.
And I think it also brings up a good point about the fear of double counting. Like, don't be afraid of double counting because we dedupe the back end. We want to make sure everybody counts. So if they are in this kind of weird situation where they're in an emergency room and you're not sure if they've been counted by someone else, please conduct that survey. Yeah, we'd rather have everybody count and do a little bit more work on the back end and have a better count for the New Hampshire. So good questions, though.
Better to overcount than undercount, for sure. Great. So how is the data being collected? So for all agencies, HMIS and non-HMIS, they're going to need to survey clients that are sleeping in places not meant for human habitation on that night of the 24th. Extended window can be to collect information like we kind of talked about at the beginning of the presentation, that you do have up until 7 days after the point in time to continue to ask these questions to survey. But again, we want to make sure that we're asking that question of when did you sleep? Where were you sleeping on the night of the point in time? That's important. The paper survey can be used, and then all that data is collected. It's entered into a Google form by the agency who collected it, and then that's when we take the Google form responses and we dedupe and combine them with the HMIS. It's important to note too that all the data on the survey is required to be collected. Again, as we said previously, we can't have any missing data. We can actually show a picture. Shatina has it up on her computer, the paper forms and what they look like, just so you can kind of have a little bit of a visual. Again, we do have this on our knowledge base website that you can pull from. And I'm sure that everybody has access to them at this point. But if you want to pull that up, Shatina, we can kind of take a look at it.
And I do just want to jump in, like really emphasize that up to 7 days. So I know as we're planning within the balance of state, some of our more rural areas, brought up in the past, maybe a snowstorm hit the day of the pit, right? So we know that the count maybe wasn't as accurate as it could have been. So please, by all means, use those extra days to go back to that night, the 24th, to see where folks stayed. Again, we want an accurate count, and that may mean an increase in homelessness by the numbers, but we need to get to a baseline to understand the scope to be able to really work on a solution to reducing that number. So I think after this presentation, we'll probably just highlight a couple of areas and how they're approaching that, but definitely the 7 days, please keep that in mind during the week of the point in time.
So this is what the paper form looks like. Again, it's all the same information that is collected in HMIS. It's just kind of on a paper form instead. It gives you a little bit of a script to kind of say, hi, my name is this, I'm volunteering for this. This is kind of what we're doing. We're conducting this annual count. And so it'll kind of walk you through what to say. And then if the client says that if they refuse or are unable to be interviewed, that's when we're going to do an observation instead and kind of fill out what you see. And Mandy might be able to touch a little bit more on that. But if they do say, sure, I'll fill out this form, this is the next steps that you're going to take. So asking, where are you staying on the night of Wednesday, January 24th? What type of place were you staying in? Again, place not meant for human habitation. Were you in a tent, campground, all of those places? Or were you staying in an emergency shelter, transitional housing, hotel room? It's going to give all of these options. Where were you staying that night? And then if we scroll a little further down, next question, this is all of that household information. So this is that information that we were talking about in relation to the PIT report, where you're asking them what their name, date of birth, their age range, their gender, their race and ethnicity. Again, those are all the same questions that we're asking in HMIS. We want to make sure that we're filling that out to the best that we can. And then it gives you some information down here about the date of birth, the age range, the gender, what we're kind of looking for these. These are the options that you can choose from in HMIS. So it's going to give you those options down here below. And then currently fleeing from domestic violence, HIV, AIDS, and then some disabling conditions as well. And if you want to scroll a little bit further down.
Sorry, we just had a question.
I was going to just go through the form all together and then answer questions. Okay.
That's,
yeah.
That's good.
I just want to make sure we get through it first. So again, disabling conditions, and then history of homelessness. So again, this is that per HUD definition. Is this the first time that you've been literally homeless? How long have you been literally homeless? If it's the first time, how many separate times? This is that HUD definition of what they're counting as literally homeless. So it kind of is nice that it breaks it down for you so that you don't have to think of that definition off the top of your head. It kind of walks you through those steps of, is this person literally homeless per the HUD definition? And then you can keep scrolling. I think we're close to the end here. And then down here in our little section about do not count that we already talked about, these are the people that you're not going to count. So it gives you a little reminder if these people are doubled up couch surfing, paid for by motels, those are the clients that you don't want to count. And then in our nice big red bold writing here, we have the due date is by 2/8/24. So that's kind of what the form looks like. And then I think Shakini said we had a question. I think I saw something about the Google Forms in the chat.
Yeah, in the chat. Sue's just wondering how we access them.
Yeah, so we have the Google Forms that are going to be up on our ICA website. It's in our PIT and HIC knowledge base article, which again has been sent out in the newsletter. We're going to include it in our emails for the PIT reporting, but you can access them through our website. These are just the demo links, the ones that are up currently. We don't like to post the actual live links until the week of the point in time, because we just want to make sure that nobody's actually going in there before and accidentally entering data. So these are the demo links. If you want to take a look at them before the point in time, you can find them on our website. And I don't know, Shatina, if you or one of us at some point can drop the link to that in the chat here as well. But it's going to go over exactly what you just saw in the paper survey. So if you want to go in, you can kind of play around with it and kind of see what it looks like, enter some data. Feel free to enter fake data in here so you can practice with it. And then the week of the point in time is when we're going to set up those live links so that you can begin using them once we have the point in time. Thanks, Shakina.
And we have another. Yeah, one other question. I didn't see it. Do we have to use the Google Forms for everyone?
For everyone, I'm not sure what, for everyone in the house.
Kelly, can you elaborate? I think she means everyone in the household, but on the form, you could see that there were spots for each family member. And then that translates to what goes on the form in Google.
Mm-hmm. I'm assuming that's what you mean, Kelly. But if not, shoot us another question.
Mandy, anything?
Well, and I want to just say that there is that checkbox going back to the paper form you saw of an observation. And I just want to stress how careful we want to be with that. You know, this is really about collecting information and having people be a part of that. So I'm very hesitant always with that observation box. You know, we don't want to assume gender, we don't want to assume ethnicity and race. So as much participation from the individuals that you're working with that we can get, please, please, please go that route. Technically, it is a choice that we have there, but again, be very careful with that.
Yeah, and that kind of goes back to the missing data too. We don't want to have to choose people's race or ethnicity or things like that for them. So as much as you can possibly get from the clients that you're speaking with, the better. We all are. So, all right, great. So we talked a little bit about the paper survey already. We've taken a look at it. The paper survey is used by all 3 COCs. It's the same uniform survey across the whole state, so you'll all be using the same thing. Again, can't stress enough, all required data is on the form, it's required. The PIT committee creates and edits and approves the survey months before the point in time, so that's kind of how we get to what survey we're going to be using. And then the PIT committee is made up of leadership from all 3 of those COCs. So that's why we have a nice uniform point in time survey across all 3 COCs. And then again, the Google Forms. ICA creates the Google Forms. They match the paper survey exactly. We use that raw data, and again, we deduplicate it. We produce the aggregated data once all of that is cleaned up and deduplicated, and that's what we then submit to HUD. The Google Form surveys can be found again on our ICA knowledge base in the PIT and HIC article. Shirtina just had it up, and we might want to pull it up and show it again, Shirtina. So this article is all about the point in time and the housing inventory chart. So it's going to have everything that you need in it, the timelines that we were talking about, some of this information about what it is and why it is for the housing inventory chart as well. And then below is when we have all of our resources. So we have some like quick guides and some the access to the paper forms, the Google Sheets, everything is on there. And then once this, Melissa started recording this video as well. So once this training is complete and we get the recording, we'll post this onto our website as well, so you can access it and go back and look at it if you need to. Perfect. And again, those live links will be there the week of the point in time. So you'll be able to access those. Great. So that's kind of the end of our PowerPoint presentation. The next step is that Shirtina is going to pull up HMIS, and we're going to kind of go over the report and what it looks like. Does anybody have any other additional questions on anything we just went over before we do that? Did I miss any in the chat, Shirtina? I think we got them all.
No, we'll just put our, I realized there was one last slide that I missed on the PowerPoint, but we'll just put the email if you have any questions that come up after the fact. We also will have office hours that will be in our newsletter that come up if anybody has any questions as we start going with the PIT. It'll be after the PIT. The dates will be in the newsletter. I don't know them off the
It's
top of my
already
head.
been in the newsletter. Yeah,
Look at that.
It's already been in the newsletter. It will be again. It's January 29th from 10 a.m. to 12 p.m. So the link to register for that is in the newsletter. Like Shirtina said, it's a time, 2 hours that we set aside to, if you want to look at your point in time reports, you want to talk to us about anything, we have that time set aside. So you can register for that with the link in the newsletter.
So the PIT report that we're moving into, that's specific to sheltered HMIS agencies, correct? So before we move into that, since I know there's a lot of people on here for the unsheltered count, I just want to, because it is so different in that you're going out, you're canvassing, you're working with your community at large to really go out the following days after the 24th. Know that there are PIT planning committees happening throughout the state. So if you haven't already been looped in or connected, please reach out. We can connect you into your local community for kind of joining in on that, either street outreach canvassing, being part of actually working with individuals experiencing homelessness, or other ways, like maybe making PIT kits or, having soup on, or, there's a bunch of different roles that I think all contribute to making that day successful, that maybe not necessarily direct outreach. So please let us know afterwards. And I think there are a couple other things coming through the chat as well.
I see one from Melissa. I think I know what it's asking. It's this one for the point in time count purposes only. What is the effect an observation has when no one is counted without all data entered? I think I'm not sure what no one is counted without all data. I think it just is asking what happens if we have missing data. Is that, I don't know if I'm reading, Shirtina or Mandy, if I'm reading that wrong.
Yeah, if whoever asked that question can elaborate on it, just
Yeah.
so we have clarity on how to answer it.
Yeah, I'm not quite sure. That
So
would be great.
if
Hi.
we do have
Yep,
missing
that was me,
data,
Mandy.
okay, go ahead.
What we're being told at one part in the slides that we need to have all data in order for someone for it to be counted. If we're just doing an observation, what is the effect that has on the count? You know, what is the purpose for the pit count itself? I'm not saying it doesn't have other purposes,
Right.
but just for the pit count itself, for the unsheltered.
Yeah, it's a great question because so what happens, and maybe ICA can further explain, but what happens if they don't have all of the data, it defaults to the population at large. So again, going back to either race or ethnicity or gender, it will default to whatever is the largest number in the system. So it will skew our results because it will not necessarily be accurate as that person identifies.
Because we
Thank
live
you.
in New Hampshire and we are primarily in a white state. So for example, it's going to default to white. So that's the impact that it has, is that we're not necessarily getting the correct count.
Okay, I just wanted to make sure because we want to get as much data as possible. Obviously, we want to make sure our folks are counted, but I just wanted to make sure what was the effect of that. Thank you.
Sure. Okay, so I think we're probably good question-wise, and we can move into the system and kind of take a look at what that report looks like. And hand it over to Shirtina.
Okay. We just had this is recorded. Somebody just asked in the chat. So we'll put it on the knowledge base, like Robin said. I did put the link for the knowledge base into the chat. So if you don't subscribe to our newsletter, you should, but if you don't, the link is right there and you can access all of the documents we've reviewed. And then this training eventually will be on there as well. Christy.
Hi, thanks. We're also hoping that the recording we will get it up on the Bureau of Homelessness Services website, and we can send out that link as well.
Great. Okay. I'm going to go into what the report will look like. This is for, again, as Mandy had mentioned, for the agencies that do enter into HMIS. So the agencies that don't enter into HMIS and are doing the non-sheltered, that is the Google form, and the Google form data will then be merged with this, and that's how we get the ultimate, the end numbers for the pit. So again, for agencies that enter into HMIS and will be receiving a report from us. I just don't want people to get confused. So let me share my screen again. Zoom is insanely difficult to share. Okay. Can everyone see my spreadsheet? Great. Okay, so when you receive, according to that timeline, we'll be running all of the reports for each individual agency the night of the pit. So the day after the pit. So any emergency shelter, transitional housing, or safe haven, we'll be running the report for you and sending it over to you the following day. And this is kind of what it will look like. Except there will be no highlighting. I highlighted this for the purpose of what we will be looking at. But as I mentioned before, this doesn't combine any families together. So this will just give you all of the clients' unique IDs, their ages, all of the required questions, but it will tell you over here in column U what their relationship to head of household is. So it's important for you as an agency to know how many clients you should have had the night of the pit, and then how many households, so that if you see a head of household, a child only household, then you will know that you are missing, a couple members on the report. I don't know why this downloaded with this fun little symbol, but that's supposed to say head of household's child. And like Robin mentioned, there are some that will be empty because it's for children. So children don't need to have their veteran status. Obviously, it's child, no veteran status. And then the DV questions are not answered for children either. So if you see some of these blank, it should relate to a child. If it doesn't, then you'll need to go back and answer it. Because we are in a better system, most of the time it doesn't let you move forward if you didn't answer this. But there are cases where that might be, there are times when that might be the case. The other thing to look for is that if this says survivor of domestic violence, if this is a yes, there should be a response in the next column. So yes, no, yes, no, yes, yes. So we want to make sure that there's a follow-up answer if this does say yes. The additional required data elements that are there are the race and ethnicity, secondary race, and those should all be, race and ethnicity should be completed, but that's something probably on our end that needs to be fixed. I didn't notice that till right now. Oh wait, nope, it's over here. There's the right column. Okay, so this is what it will look like. It should, if you are a big shelter, FIT has a very large shelter, this will be a really big and possibly overwhelming report for you to look at. You can filter columns however you want to look at to sort through that, but this unique ID is how you'll go into and find the client that may have any errors. So for the sake of this training, I highlighted the few errors that were intentional. Data not collected is an error. Data not collected here is also an error. And data not collected and veteran status of this is a child. That's, I don't know, that's an adult. It should be, but the data not collected should have, should all be, you should go back and fix them. Does anyone have any questions about the way this looks so far? Before I go into the actual clients, Robin, anything I'm missing?
I don't think so.
Chat, anything in the chat?
Nashua City Welfare recently started entering into HMIS. The clients were served in hotels. Will we receive this report?
Yep, so hotels, motels are considered emergency shelter for the city. And any welfare that doesn't enter into HMIS, we use a Google form, but if you enter into HMIS, those are considered emergency shelter and we'll send those over to you.
Mm-hmm.
Did I see something else in the chat too? I think somebody, can you define the age of a child? Yep, so unless you're a youth provider, you shouldn't have any head of households that are under 18. So the children are under 18 and that's why those questions don't populate. Does that answer the question? Okay. All right, so when you receive a report and, oh, something else? Okay, great. So when you receive a report and you do see some of these errors that you might need to fix, or you do notice that there's somebody that doesn't need to, that has to be exited. Another thing I didn't mention was making sure that any client that has to be exited the night, that has to be exited because they weren't there the night of the pitch, should be exited from this report. And then from the program for this report, and then anyone that needs to be added, the same thing, you'll have to add them in to make sure that it's counting all of the people that are there. That's why we send this report. And then like Robin mentioned, we have the back and forth for a few days because you might have clients that you need to enter that, I mean, guys are all super busy. You may have not been able to enter them right away, especially in a shelter setting. So if you do see that this is too little or too many or whatever, we obviously go back into the system. So because I put enrolled a test client and I didn't enter some information, I'll just show you how to kind of go back into the system. Everybody should know how to enroll a client if you enter, into how to get that information in there, but I'll just quickly show you. I have to figure out how to change my screen. Please hold. Okay, So you log in like you normally would. And you, in this case, I'm already in my client. So I knew that for my report that race and ethnicity was not collected. And again, this is one of those required data elements that HUD is not going to let us submit. So if we see this on the report, we send it to you, we see on the report that it's not there, but you tell us that this is confirmed, we're going to come back and say this is something you need to answer. Again, because we can't stress enough that HUD is just not going to let us, and the COC leads are put in the position where they have to make a decision. And again, we'll just defer to white because of the state that we live in, and that may not properly collect the right information. So you will have to go in, change this information to whatever it may be, and then save it. The other question that we didn't have answered was their disability, I think. So you'd want to go into your program that you've entered the client in, and you want to make sure that all of these are answered. So all of these disabling conditions here, you can see data not collected. So I would just change that to whatever it is. If this is, the data is not collected, the client doesn't know, again, you have to put something. If you can't if it's a situation where unless somebody has a disability, like a SSDI letter or something, and they're saying no, it's self-report, so just put no, and make sure that you have the following questions answered so that it comes up on the report. Another thing that we want, that I wanted, oh, it looks like there's something in the chat. Our organization only uses HMIS to report clients covered by cold weather emergency response plan. Otherwise, we usually use. So, okay, so the question is, I was reading it quietly to myself. So there are some agencies that may have a cold weather like day center or something, and then additionally offer shelter in another case. They would be using, you would use both non-HMIS, the Google document, and then HMIS. Does that make sense? So some of the like warming stations will be using the Google document. Outreach may be collecting, maybe going out to collect that information, however your community wants to do it.
Thank you. Yes, that answers that question. Thank you.
No problem.
We also have
Robin?
a question from Lynn about conflicting information. So it's not conflicting information. So HUD does not accept any missing information. But what happens is that that's how it's not missing. Once it's missing, then we have to say, here's the answer, and we give them that answer. And then it goes into HUD as that answer, right? So it might be missing originally. You can't get the information, but then the COC leads are going to say, okay, this person's race was not collected. That means that they're white. And then we're going to put it in as white, and then it's going to get submitted to HUD with the answer of white, even if you didn't collect that information. So, so it might be missing originally, but then it's going to get an answer, and it's going to be submitted to HUD with an answer, whether you collected that information or not. Does that make more sense?
Thanks for clarifying, Robin. Yeah. And that's exactly right. So the answer may not be there originally, but we have to come up with something, and then because otherwise HUD would be like, nope, we can't take this. And then Olga, I saw your question about people staying in the warming station. So this is something each COC, I think, and Mandy, you might have more of a perspective on this, but I know that people in the warming stations that are not sleeping, that did not sleep at a shelter the night before, or at your shelter the night before, are counted as unsheltered. The people that are in your shelter the night before, they would be put into HMIS as sheltered that night because they were in your shelter.
Yeah, I think that's actually a perfect example of why you do community counts, right? So working hand in hand with your outreach teams on who's being counted on shelter, or if they can do drop-in hours at that warming station. Again, don't be afraid to double count. We want to make sure everybody's counted, but there are ways you can be strategic and use each other. I know Sue, I think, is spearheading that down there. So you all do so well in Nashua of having that comprehensive planning, but yeah, it's a great point of why you use each other as partners to make sure that everybody is counted, regardless of their situation.
Does anyone have any more? Those are really great questions. The warming stations are really confusing for people. So, including us last year, we had a lot of questions because who's counting them? So yeah, if they did not sleep, if you are meeting with them on the day after that Thursday and they did not sleep in your shelter the night before, then they would be counted, or in a shelter, they would be counted as non-sheltered. Decline to answer instead of leaving blank. In HMIS, there is the option the client did not answer, but again, we will still have to put a response there. Okay, so any more questions? Okay, great. So I'm going to go back to the report. So once you fix those errors, you'll come back to us and say, these errors have been fixed, and we will send you a report back. So it's that back and forth that once you get the report, you look at the data, you decide, you are able to fix whatever you need to fix, or if there's nothing that needs to be fixed, then you're like, all right, this is good. We confirm it. We send you a copy and we keep it on a copy for ourselves and confirm it as the report the night of the pit. You will then, when you get your new one, you'll have the correct answers in these highlighted spots instead of the ones that are highlighted. And you will, that is what that's what we'll use for HUD. So the next thing that is a big, something to really remember is that the data that you've confirmed with us is the data that we're submitting to HUD. So we've had in the past people go back and change data without letting us know. So whether that means exiting clients, I'm not talking about specifics of like data elements, more so exiting or enrolling clients for the night of the pit that were not here on this confirmed report. If you do need to do that, it's important that you let us know so that we can update our numbers, because otherwise we're submitting, 10 clients on the night of the pit, and then we run a report closer to submission and it says that you have 12 clients. And then we come back to you and we say, did you add these clients? These numbers are different. What happened? And then we do the back and forth again. So whatever you confirm with us, that's the number that we are sending to HUD. And of course, we know that things happen, et cetera. That number, if it does need to change, then just let us know. But we need to be sure that the number that we are confirming is the number that we're submitting and that your data doesn't change. Does anyone have any questions about that? Okay, so that's kind of the entirety of what the report will look like, the going back and forth, and the data, the cleanup. Again, because we are in a much better system than we had been in the past, the system doesn't really let you move forward. Even when I was trying to make these intentional errors, it was like, hold on, you messed this up. So we don't anticipate there to be a lot of errors on these reports, but we do often have this case where people need to be added or exited from each program. And that's something more so to keep in mind when looking at these. Robin, did I miss anything?
I don't think so. I think that's the gist. The only final thing is that when we do send you the final, like this is it, this is your confirmed report, we're also going to send you the aggregated data of that report. So it's going to just say this is the amount of households you had, this is the amount of adults with children, adults only, this is the total count. So we just kind of do it as an additional check just to make sure here's the exact numbers that you should see in your report. So you're going to get an Excel and a PDF version for your final confirmation, just with those final counts. And we're happy to, we have the PIT office hours, as Shartina said, but we also are happy to meet at any other time with you in between. If you don't want to show up to those PIT office hours, or if they don't work for your schedule, we have Calendly links that are also in the newsletter every other week. It has all of our availability, so you can just sign up with a day or a time to talk to us about it. If you have any questions that you can't ask from the PIT office, it's reserved if you can't make it. Mandy, anything else that you would like to add?
I think the only other thing I'd like to add is just to really look at the PIT forms when you get them. Like there's a script on it, and you don't have to stick to the script of the form, but it has some specific definition information in there. You know, for me, I always think back to veteran status, and it has a specific federal definition. So if someone says, oh, National Guard, in the script, it has additional questions to ask to determine if that individual meets that status. So for the sake of the point in time, we want to have it as accurate as possible so that we can have a scope of understanding about the populations experiencing homelessness. These are the numbers that Congress uses when they're talking about homelessness across the country. So it's important to have those subpopulations be as accurate as possible so we can make the case for funding and programs and all of that good stuff. And I did put in a link in the chat to HUD just released New Hampshire's 2023 numbers as we're gearing up for 2024. So that's the New Hampshire statewide numbers, and you can also break it out by COC as well for subpopulations. So if you're interested, take a look. You know, no surprise, over the last 2 years, we have had increases in homelessness. And then we expect, again, a very comprehensive count this year. So likely we'll see an increase as again. So if you have any other questions, you know how to reach us. Again, if you have any questions about linking up with the unsheltered count and what's going on within your local community, please let me know. And otherwise, are we turning it over to you, Christy, because I know Melissa's mic is still out.
Yes. So good morning, everyone. Yeah, Melissa's microphone is still broken. I want to thank everyone for attending this Balance of State meeting today. It's really exciting. We're looking forward to the PIT count in 2024. I am going to ask, and I know we didn't prepare anybody, but do any of the subcommittees for the Balance of State have any updates that they want to provide to the Continuum of Care membership? Heidi?
Oh, yeah. So the youth subcommittee will be having a meeting on the 29th of January, which is a Monday. We'll be breaking out into work groups for the coming year during that meeting, giving updates on where our projects are at, where sort of kind of where the whole YHDP community plan is at, and context around that, and then breaking out into work groups. So that the leads for those work groups can put together how we're going to work on that during the year. So we have single points of contact again, our rural outreach folks, if anyone's interested in that. We'll be doing a youth count this year in October, so they'll be planning for that group. Trying to think of all the ones. There's a driver's ed one for young people. I think Becca's on this call. Am I missing? What am I missing, Becca? There's 5 of them.
Training.
That's the other one. I knew I was missing one. And a training work group to look at kind of following Mandy's lead with the outreach groups in terms of putting a curriculum together, partnering with the right agencies, the New Hampshire Coalition to End Homelessness, certainly being one of them, but also folks that are working with youth and young adults and kind of planning a curriculum around what would be best practices for those folks. Thanks, Mandy, for putting it in the chat too. Yeah. And also we are planning monitoring visits with all of the projects right now. Christy and I are putting that together and we'll be out there very soon.
Thank you, Heidi.
Mm-hmm.
Mandy, do you have any updates from the outreach committee, or is there we'll start there.
I mean, outreach all across the state right now is definitely unsheltered point in time. So again, if you need to be connected, let me know. And then the veteran subcommittee, I am no longer the chair of. So I think I saw Katie and maybe Emily as well. They want to give a quick update.
I can give a quick update. I don't know if Emily is on this call, but we have moved our subcommittee meeting this month. It was going to be today, but scheduling conflict. It's going to be the afternoon of the 24th via Teams. We have a lot of program updates, a lot of program changes. We have a new SSVF grantee in the state of New Hampshire. So they will be discussing that service that's being offered, and we have the Staff Sergeant Fox grant as well that's going to be presenting at that committee. Lots of changes within the subcommittee for 2024. I will send the invite link to Christy so you have it. So if anybody from Balance of State from this meeting that wants to attend that meeting, just to get more information, you'll have that opportunity. Thanks.
And a huge shout out to the Manchester VA. I don't know if we've announced it here, but they have a new coordinated entry specialist for the VA, Nicole Frizella. So we are very excited as we continue to expand the coordinated entry process and kind of moving forward with data sharing and all of that good stuff. So positive movement.
Right. Thank you both. And then Freeman and I chair the coordinated entry subcommittee for the Balance of State Continuum of Care. We were supposed to have a meeting this week, which we have canceled because we are going to have the leadership for the coordinated entry subcommittee do some strategic planning, which we will present to the entire subcommittee in February. We will also be looking at recruiting new members for the coordinated entry subcommittee meeting. We are hoping to have at least one staff person from each one of the regional access points as part of the coordinated entry subcommittee. So you will definitely be getting an email invite from me to join if you work at a regional access point. And I think that's it for coordinated entry today. Did anyone else have any updates that they wanted to share with the group?
Hi, Susan here. Just want to appreciate public health. They've really hired a lot of outreach workers. Bobby Bagley has really seen the need for the outreach, and it's made a big difference in Nashua. Just to thank you. We meet on the 22nd. Is that right, crew? At 2:30 for a powwow before the point in time. Actually, it's Tuesday, the 23rd, 2:30. So looking forward to it. I have about 22 folks volunteering this year. So, and Olga, I see you there. So thank you for taking care of the the folks for the shelter for the warming center. So we don't go through that this year. Thanks. And thanks. That's it.
Unless anyone else has anything else, I don't see any hand raised or anything in the chat. Our next meeting is in May. I do want to let all of you know that we have gone through and we'll looking at last year's notice of fund. Oh, sorry, March. I think it's March already. It's okay. It's the weather. So our next meeting is in March. Melissa and I have gone through the requirements from HUD through the notice of funding opportunities available, and we will be scheduling some Continuum of Care wide trainings. And also some very specific subrecipient trainings for all of you. So stay tuned for that. We do have a training already scheduled for the March Balance of State Continuum of Care meeting. And I think that's all we have. Patty, did you have anything? Are you good?
Actually, this may seem far afield, but it's not. We're seeing more and more referrals coming our way of people who are working but who are stating that they are homeless. So on that vein, we are just about to kickstart our free tax prep program. That is a program that is national, regardless of where you are in the country. but most especially in New Hampshire, there is a very robust number of sites of volunteer income tax assistance as well as AARP tax aid who will do anyone's return regardless of income eligibility. But if you do find that you are being presented with people who are working or who have worked recently, please feel free to have them call 211, or I can send a flyer that I've made out that can be sent to everyone as well. It is a ridiculously valuable tool and benefit for people, especially looking in a rear view mirror with COVID and all of the stimulus funds. Those people who had not thought they should be filing a tax return, it was much more difficult for the IRS to find them and alert them to those stimulus funds. So there's a lot of reasons for people to have their taxes prepared. Fuel assistance often will ask for them. So again, I will send out the flyer that I have. The reach in New Hampshire is excellent. So no matter where you are sitting, there will be a program nearby.
Thank you, Patty. Does anyone have anything else? Otherwise, I will say thank you for attending, and we look forward to seeing all of you in March. Thank you.